Well, the hour has arrived and it's 8:30. And since we're live on YouTube and live on Facebook and on our projection through AIM, and all of you who have been good enough to come in person have arrived, I think we started and not lose any time. Our goal in all that we do in research and our clinical practice is aimed not at the medical students, the residents, the fellows, the junior faculty with whom we, of course, are focused for a majority, but upon our patients and our patients' supporters and caregivers. And so you are the ultimate focus for all of the information that we develop. And the purpose for this meeting is to sort of update you each year on where we stand and to allow you to ask questions about anything that's been confusing. The past year has been singular for bringing the first cellular therapy. And so we'll have a couple of our talks devoted to that. We've been doing cellular therapy here since the late 80s, believe it or not. And Ron Herbermann, who is the founding director of the Cancer Center, was the discoverer of a cell called the NK cell. And T-cell biologists and T-cell immunologists have been amongst our ranks ever since. And the adoptive cellular therapy with patients' own tumor infiltrating lymphocytes is an exciting new venue, not just for the standard of care approach, which is of course critical to get this to patients in the community, but it's also critical to do research and new protocols. So you hear both about standard of care TIL therapy called lifileucel and about new PD-1 knockout TIL therapies. And you'll hear about the patient advocates who are in the clinics, our associates, Darcy in the treatment area and Melissa in the evaluation area, who actually interact with each of you, our patients and family members for this. Another area that's really critical is that for all that we do, we are critically dependent upon federal research support, upon philanthropic research support, and upon industrial support of our programs. So I want to thank Bristol Myers Squibb, thank Iovance Biotherapeutics, the origin of the new TIL therapy, Merck, Natera, and Pfizer, who are all here today as sponsors for the program. But I want to say that you all have a voice that's much larger and louder than ours. And one of the things that in this time of some turmoil, we really want you to realize that you hold the keys to the future as well, and your voices need to be heard. And I'm going to leave it there in terms of that, because it's part of our purpose to educate you on what is available, but also to understand that you are critical as our patients and patient caregivers to the impact, which will be felt across the nation and in DC, where it is so important. For each of the presentations, part of the purpose is to ask questions and to have our speakers answer your questions, because that is the purpose of the symposium. And so we'll break at the terminus of each of the talks, ask for questions here. And I'm told, although I don't do this routinely, that on YouTube, you can put in the questions you have in comments, and in Facebook, similarly in comments. And we have one of our residents who's been good enough to come to the meeting today, who's going to monitor both of those, transcribe them, and get them to the speakers so that your questions can be answered, because that's the purpose of all of this.